Sorry, guys, just an example of the problems I've been having. Internet dropped out again. So I'm here using the phone. Hopefully this will work. Okay, so let's go back to where we were. Mono. Couldn't be done. Well, I know why, because he lost the connection. That's why. Okay. All right. So, do it. Okay. All right. So, go.
Hello, today I'm going to talk about glandular fever. It's basically an infection caused by a virus, the Epstein-Barr virus. It is sometimes known as the kissing disease because the virus can be passed on via saliva. Coughs and sneezes and sharing food utensils can also pass it on. It's harder to catch than a cold. It generally affects teenagers and younger people. A full and quick recovery without the need to see a doctor is the usual course of events. Some can carry the virus in their body without developing infection. This is harmless. Normally, it's not possible to work out who gave the infection to whom. Symptoms begin between 4 and 8 weeks after infection and start with a very severe sore throat, swollen tonsils, a high temperature, and difficulty swallowing. Other symptoms include tiredness and poor appetite, muscle aches and headaches, swollen tender glands in the neck and armpits, skin rash, sometimes associated with antibiotics, abdominal pain. No response to antibiotics makes glandular fever more likely. Glandular fever is very difficult to diagnose from other causes of sore throats and tonsillitis. In most cases, this does not matter. The symptoms will resolve quickly. Glandular fever symptoms are unlikely to improve with antibiotics. Antibiotics don't work for viral infections. Most sore throats need no investigation. If, however, after a trial of antibiotics your symptoms fail to resolve, your doctor may decide to take a blood test. These can confirm whether glandular fever is present and look for other infective causes. Still, no treatment will be possible, but at least you will have a better idea of what to expect. If you have glandular fever, the doctor will advise measures to help improve your symptoms by reducing your fever and ensuring plenty of fluids are drunk. Avoidance of alcohol is helpful. Like most infections, symptoms can range from mild to severe, but you should feel better in a week or so. Unfortunately, in some cases, glandular fever can be extremely severe. This is rare. Some people experience fatigue and low mood for weeks after initial symptoms have subsided. This is not so rare. Most cases of sore throat are not glandular fever. Consult your doctor if symptoms are persistent or if you are significantly unwell, have great difficulty swallowing, or you have abdominal pain.
Okay. Sure. So the guilty party here is the Epstein-Barr virus, right? And you can get it from direct or indirect contact, or you can ingest it, all right? What makes it, what are its weapons? Latency, meaning it can become part of our own DNA and then live there for the rest of our lives if it wants to. And then when it decides to erupt and become lytic, then it will, okay? So it's like it's like herpes zoster. And that once you get it, it's always going to be there in some form. Prevention. I don't really have anything. Okay. At this time, no vaccine. Okay. So the treatment is supportive, which means let your body deal with it. Okay. All right, hemorrhagic fever. Okay. This infects the blood and the lymphatic tissue and causes fever, some of which results in internal hemorrhaging, which is what? It's bleeding. The virus is in the blood and causes the capillaries to get fragile, and it can cause them to rupture, okay? And it can interrupt blood clotting, right? And that can lead to massive bleeding and death, all right? The viruses are all RNA enveloped, right? And that means that they can hide from the immune system. Okay, because they're wearing a cloak of membrane, right? An example, Ebola showed a weakness in the public health system for swiftly spreading contagious diseases, right? Ebola, the symptoms are tissue destruction, followed by death, okay? Very rapid. Chikungunya, transmitted by mosquitoes in the US and Central America. Yellow fever in Africa and South America. The Aedes aegypti mosquito. Is the vector here. Dengue in Asia and India, South America and Central America. And also the Aedes group of mosquitoes. Ebola in Marburg in Africa. The capillaries get really fragile and the patients can bleed from everywhere, okay? And bats are thought to be a reservoir. Lassa fever, West Africa. Most cases are asymptomatic. Others, you get the severe internal bleeding. And the reservoir is the multi-mammate rat, okay? So you can see here, I mean, the signs, right, are all going to be internal bleeding. Okay. Modes of transmission, most of these are going to be a biological vector, all right, meaning most likely an insect. Okay. Exception, Marburg, right, and Lassa. You can go through body fluid contact for Marburg or in the air for Lassa, okay? What do they all do? Well, you can see it right here. Disruption of clotting factors means you bleed to death, right? Bleed out. Okay. There's a vaccine for yellow fever. There's nothing here. Okay. And here, avoid the reservoir, rats and contaminated food. Okay. The treatments, notice, right? If you've got it, all we can do is make you feel better. Supportive, 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 supportive. Okay. Lhasa, there is something on the market, ribavirin, right? So very dangerous, right? Non-hemorrhagic fever, you generate a fever, but you don't have the internal bleeding, okay? These are caused by bacteria. An example is brucellosis, also sometimes called undulant fever. It's often a result of placental infection in livestock and is a bioterrorism agent. What do we see? Well, these live inside phagocytic cells, so inside macrophages. Okay. Carry the bacteria into the blood that way, create lesions in the liver, spleen, bone marrow, kidney. You get fever. The agent is Brucella, an aerobic gram-negative coxobacillus. Examples include abortus and suis. It can cause the disease in humans, okay? Principal manifestation is placental infection and fetal infection. Human placentas don't get infected, but animal ones do, okay? Q fever, the name came from not knowing what caused it for a long time. You get fever, chills, muscle aches, a rash. Sometimes you get complications like hepatitis and endocarditis. A lot of cases are chronic rather than acute and cause vascular damage. The agent is Coxiella burnetii, a pleomorphic gram-negative bacteria. Now, what does pleomorphic mean? It means many shapes, okay? And it's gram-negative, so it's going to be pink, right? It was thought to be a rickettsia. It is an intracellular parasite, okay? And resistant to environmental changes because it can form a spore, okay? You see it in a lot of insects and a lot of vertebrates. Ticks can be a vector between wild and domestic animals, but they don't give it to humans. Humans get the infection by environmental contamination and airborne, okay? Airborne spread. Birth products like placentas of domesticated animals can have the bacteria in it. You also get it from urine, feces, milk, and airborne from the infected animal. Who are the people at risk? Farm workers, meat cutters, okay? Lab techs, vets, okay? What do? Sometimes we let it resolve. More severe cases, doxycycline, okay, which is an antibiotic. Cat scratch disease. 1 to 2 weeks after being clawed or bitten by a cat, you get papules where the bite or the claw marks were. It usually resolves, but the agent is Bartonella henselae, a small gram-negative rod. So pink rod. Okay. It's fastidious, but it's not an obligate intracellular parasite, so you can grow it outside an infected animal. Fastidious just means picky. Okay. It's present in over 40% of cats, especially kittens, 25,000 cases annually in the US, 80% for children between 2 and 14. How do we treat? Azithromycin and erythromycin and rifampin, okay? And these are all what? These are all antibiotics. It can be prevented by antiseptic cleaning of a cat bite or scratch. Okay? And then our next one is Rocky Mountain spotted fever. Let's see how we deal with this.
Good afternoon and welcome to today's brief discussion concerning the disease Rocky Mountain spotted fever. What I hope to accomplish is to increase your basic understanding of the disease, how it is diagnosed, treated, and prevented. Rocky Mountain spotted fever, according to the Center for Disease Control, is the most severe tick-borne rickettsial illness in the United States. This disease is caused by the intracellular bacteria Rickettsia rickettsii, a delightfully redundant name. We'll call him Rick from now on. Rocky Mountain spotted fever is considered a seasonal illness, as around 90% of all cases are reported between the months of April and September each year. Contrary to its name, Rocky Mountain spotted fever is most common in North Carolina and Oklahoma, which compose 35% of yearly cases. The entire Rocky Mountain region, however, only contains 3% of cases. Between 800 and 1,200 cases are reported each year in the United States. This figure makes the previous statements even more apparent. You can clearly see the concentration of cases in a thick belt between Oklahoma and North Carolina, with Oklahoma and North Carolina carrying the most concentrated areas. Additional patterns that have shown up over the years is that the most common people to be infected are Caucasian males and children. In fact, 2/3 of reported cases of RMSF occur in children ranging from 5 to 9 years old. It's also been shown that people that spend extensive time around dogs are more likely to get the disease at least once, since they carry the most common vector for the disease. So by now, you're probably wondering why it's called Rocky Mountain spotted fever in the first place if it's rare in the Rockies. And for that, we're turning our attention to Howard Ricketts. Howard was a pathologist working for the University of Chicago when he became interested in RMSF after hearing about its discovery in 1896. He and a research team not only managed to isolate the responsible organism, but also its vector. This was in 1900. Unfortunately, Howard died a mere 10 years later in Mexico City after isolating the organism behind typhus, which is another rickettsial illness. He was killed by the organism he isolated. The organism behind RMSF is named in his honor. Now that we know a little bit more about our little friend's history, let's take a look at some of its general attributes. It is an obligate, intracellular, gram-negative bacteria that is non-motile and highly pleomorphic. It is able to take on the form of rods, cocci, and long strand-like threads based on its environment. It relies on eukaryotic cytoplasm for replication, and its home of choice is the endothelium of small to medium-sized blood vessels. In order to infect vertebrate hosts, it uses a vector in the form of a tick. The two most common ticks that act as vectors are the American dog tick and the Rocky Mountain wood tick. The life cycle of our tiny assailant is extremely convoluted, but at most it looks something like this. Infected tick bites vertebrate host, an uninfected tick bites the infected host, the uninfected tick becomes infected. If the tick is male, it infects a female through mating. If the tick is female, it lays eggs containing infected larvae, which hatch into infected ticks, and the cycle starts over again. After entering the body through a tick bite, our friend Rick sets up shop. As stated earlier, he prefers small to medium-sized blood vessels if he can get them. Once inside a host cell, Rick replicates inside the cytoplasm or inside the nucleus, causing cellular damage. This leads to microscopic damage to the vessels, allowing tiny amounts of blood to escape. This escaping blood leads to the characteristic rash that is common in RMSF victims. This cellular damage can also directly damage organs. As far as signs and symptoms go, there are several. Initial symptoms include fever, nausea, vomiting, muscle pain, lack of appetite, severe headache. Later signs and symptoms include rash, abdominal pain, joint pain, and diarrhea. In other words, you really don't feel well. You're not a happy camper. There are also several ocular signs and symptoms, such as petechial conjunctivitis, anterior uveitis, retinal hemorrhages, cotton wool spots, retinal vascular engorgement, tortuosity, branch retinal arteriolar occlusion, and optic disc edema. As you can see, these signs are just as numerous as they are varied, and as a result, you will probably not be able to make a diagnosis directly from these ocular findings. Diagnosis comes chiefly from symptoms and history, as there is no fast lab test for diagnosing RMSF. Lab tests are usually done for confirmational purposes only. Physicians instead rely on the classic triad of fever, rash, and history of tick bite to determine if treatment for RMSF is necessary. If the patient gets better, it was probably RMSF. If they want to confirm their diagnosis, they look for thrombocytopenia, hyponatremia, elevated liver enzyme levels, and a positive indirect immunofluorescence assay. The IFA is the reference standard for identifying RMSF. If the disease goes untreated, you're in a heap of trouble. RMSF has a 30% mortality rate if no action is taken, and a 71% hospitalization rate even if action is taken. RMSF can wreak havoc on your internal body systems, causing things such as gangrene, pulmonary hemorrhage, myeloencephalitis, and myocarditis. The good news is that RMSF is very treatable. Almost every case responds against doxycycline, the drug of choice. If doxycycline isn't an option, chloramphenicol is used instead. Of course, the best way to fight against the disease is to not catch it at all. The most effective yet most extreme method is to not go outside between April and September. A slightly more attractive option is simply to wear lightly colored clothing so the ticks show up better. You should also check yourself thoroughly after being outside in an area where you are likely to pick up ticks. The best course of action as far as clothes are concerned is to tuck your pants into your socks to prevent ticks from climbing up your legs. And although that sounds both hot and silly looking, consider this a possible alternative. Anyway, it's also good to spray your shoes and clothing with permethrin, which can last for days if you're out camping. Use spray containing DEET on your skin, but be careful. DEET only lasts for a few hours. Also be careful using DEET on children, as it is known to cause adverse effects in high amounts. Last but not least, if you see a tick on you, get it off as soon as possible. This brings us to a critical point on the proper removal of said tick. To properly remove a tick, you must grasp it as close to the skin as possible with fine-tipped tweezers. You must then pull up with even pressure. Avoid twisting, as this could cause the mouth to break off or the tick to regurgitate, increasing your chances of infection. After removing the tick, disinfect the area and wash your hands thoroughly. The CDC also recommends you place the tick in a plastic bag, date the bag, and then place the bag in your freezer in case you get sick. This would allow for a quicker and more accurate diagnosis of your illness. In conclusion, remember that prevention is a very powerful ally in defending yourself from RMSF. And if you have RMSF, the best course of action is to get it treated as soon as possible. If you would like to learn more about Rocky Mountain Spotted Fever, I highly recommend the Rocky Mountain Spotted Fever section on the Center for Disease Control website. Thank you for listening.
So you can see again, the diseases and their guilty parties and their weapons, right? So we can go through here, talk about a few of these, right? Brucellosis, Brucella bacteria, right? Q fever, Coxiella, cat scratch disease, Bartonella, and Rocky Mountain spotted fever, Rickettsia, right? So how this spread? Airborne, right? Or needle sticks. Airborne or foodborne for Q. Cat scratch or cat scratch fever, right? And then we got the tick again with Rocky Mountain spotted. So the tick here, right, spreads two diseases in the tri-state, Rocky Mountain spotted and also SF, and then also the spirochete disease from earlier, which is Lyme disease. So you got to watch those ticks. Okay, they love those blood meals. Okay, what are the weapons? Okay, intracellular growth, again, growing inside cells, meaning it's hiding from the immune system for brucellosis. Endospore for Q fever, okay? Endotoxin for cat scratch, and producing apoptosis, which is what? Cell death. Cell death in the blood vessel lining, right? treatment. Doxy, azithromycin, doxy. All of these are what? Antibiotics. Okay. Okay, next is Chagas disease.
Definition. Chagas disease, also known as trypanosomiasis, is an infectious inflammatory disease caused by a parasite found in the feces of the triatomine or reduvid bug, which is very common in Latin America and the southern United States as well. Symptoms. Symptoms pretty much range from mild and acute to severe, and patients usually do not detect symptoms till the disease hits a long-lasting chronic stage. Acute phase. This usually lasts for weeks or months, almost symptom-free. Typical but mild symptoms that may show up include the following: fever, swelling around the infection, eyelids and glands, fatigue, body ache and headache, rashes, loss of appetite, nausea and vomiting, diarrhea, enlarged liver or spleen. Acute symptoms usually go away on their own, but in some cases, if left untreated, they advance to the chronic phase. Chronic phase. This phase may never show up or may show up 10 to 20 years after the first infection. Typical symptoms in severe cases include the following: irregular heartbeat, congestive heart failure and sudden cardiac arrest, abdominal pain or constipation due to enlarged colon, difficulty in swallowing food due to enlarged esophagus. Risk factors. This disease, most often diagnosed in children, can literally infect anyone. Living in structures built with mud, adobe or thatch in rural impoverished areas of Latin America where the triatomine bugs are rampant. Traveling to a high-risk area of Chagas disease. Blood transfusion or organ transplant from someone with Chagas infection. Diagnosis. The doctor will ask for the following: a physical examination to check signs and symptoms of the disease or any risk to the disease. Blood tests to confirm the presence of the disease in the bloodstream. Additional tests like ECG, chest and abdominal X-ray, echocardiogram and upper endoscopy to check the stage of the disease and the resultant complications. Treatment. Prevention of infection is always ideal. The first line of treatment is to kill the parasite in acute infection and then go about managing signs and symptoms in later stages. If left untreated, it can cause severe heart and digestive problems. Treatment for heart-related complications include medications, pacemaker or any support device to regulate the rhythm of the heart, surgery or a transplant. Treatment for digestive-related complications include a diet change, medications, corticosteroids and surgery in extreme cases. Medications during the acute phase may benefit the patient, though not so much in the chronic stage. The medications during the chronic stage don't cure disease but help slow the progression of the disease and complications that come with it.
So you can see here, trypanosome. Okay, this is a eukaryote. Okay. It is a protozoan. Okay, and then it's the kissing bug. It's the vector, right? So it's spread by the feces. Okay. What are the virulence factors? Why does it make you sick? Enzymes that destroy tissue, stealing our own antigens to evade the immune system, and causing autoimmunity. Okay, so the strategy is similar in a way to how the spirochete does it, right? for Lyme disease. Prevent it through insect control, right? Treatment, CDC has some antiparasitics. Antiparasitics. Okay. And where is it? Central and South America. Okay. Last disease is anthrax.
Anthrax is an often fatal bacterial infection that results when the endospores of the bacteria are introduced into the body from one of three ways. One form of infection is initiated when the endospores enter through a cut or abrasion in the skin. This is known as cutaneous anthrax. Once inside the skin, the endospores migrate to the bloodstream. Another form of infection can result from the introduction of endospores into food, which is then consumed. This is known as gastrointestinal anthrax. Inhalation anthrax is the third form of infection and occurs when airborne endospores are inhaled into the body. After a brief journey to the lungs, the endospores enter alveolar sacs where they attach to the tissue of the alveoli. This is where the body initiates an immune response against the anthrax endospores. Immune cells in the body, called macrophage cells, become alert of the endospores' presence and begin to attack by exiting the bloodstream. The immune cells engulf the endospores as foreign bodies and then enter back into the bloodstream where they travel for a brief time. The normal response of macrophage cells is to destroy bacteria allowed to invade the body, then travel to lymph glands where they prepare the immune system for future attacks. However, anthrax endospores are not destroyed, but begin to germinate within the macrophage cells until they end their journey within a lymph gland. Once inside the gland, the endospores develop into vegetative bacteria known as bacilli, which are then released from the macrophage. Once released, the bacilli cause damage to the cells of the lymph gland and begin to travel throughout the lymphatic system. During their travel, the anthrax bacteria begin to grow and multiply, infecting surrounding areas where they eventually make their way back into the bloodstream. Also during their travel, the anthrax bacteria emit virulence factors which contain the exotoxins responsible for a condition known as toxemia or blood poisoning. The exotoxins are then released from the bloodstream where they invade neighboring cells. This invasion makes the cells unable to regulate their environment and causes the cells to release water and eventually die. This buildup of water causes a condition known as pulmonary edema, in which a large amount of fluid accumulates in the lungs, resulting in tissue damage and pulmonary complications. For most people, symptoms can occur between 1 and 7 days from exposure to the anthrax bacteria. Such symptoms resemble a common cold and may include fever, cough, chills, muscle pain, shortness of breath, and shock. Inhalation anthrax, if not treated, can progress to severe disease and is usually fatal.
So there's our summary. Okay. Again, whoops. Notice the coating, right? The helminths are the worms. They're in orange. Bacteria, brown. Viruses, green. Protozoa are red, right? And fungi are blue, okay? So remember that protozoa and fungi and helminths, those are all eukaryotes. Okay. And the bacteria are the prokaryotes, right? So it runs down each disease, gives you the players, right? And tells you what part of the body is primarily affected. So again, a good summary slide to star and use, right? All of these disease chapters are going to have a slide like this that'll be a nice key for you to use as you study and as you do the quizzes and the Learn Smarts. Okay, I know we went over. I know we had technical difficulties. Hopefully those have been resolved now. And I will see you guys at our normal lab time. And what we'll do there is we'll do the next chapter. All right. So we'll do chapter 19, and then we'll have some lab practice for the practical. Okay. And then I'm gonna get you the practical this week. Okay. And you'll have a week to work on it. So you should be good. In order to do well on the lab practical, you need to make sure and do the labs that have been assigned to you. Okay. So that you fill those out, you complete them, and I get them back to you. Okay. I'm also going to post, or I'm going to give you guys some keys to the labs that you've done. All right. So that you know what the correct answers are, so that you're prepared for the practical. You can do well on it. And other than that, that's all I've got. I'm going to enter your Connect grades. Okay. And that should update you where you stand in the course. And I should see you in lab at 1 o'clock. Does anybody have any questions before we bump out? We're good?
Thank you.
Okay, thank you so much for hanging with me here. This has been a nutty problem with the internet stuff. So I
No problem.
appreciate you being patient with me. So I'll see you guys at 1 o'clock.
All right, 1 o'clock.